Hi, I'm Dr. Mark Tam, hair transplant doctor. Today I have the pleasure to present to you our patient testimonial, Rhys. When I first met Rhys, he was 24 years of age. He has experienced a degree of hair loss in the frontal area. He's been on minoxidil, finasteride to stabilize his hair loss. He was looking for more density in the frontal area. Let's hear it from Rhys.
My name's Rhys and I'm an office manager. I started looking into my hair loss around the age of 16 as I was getting older and mature, and I could start to see my hairline recede. Between the ages of 18 and 20, the hair loss started to become a lot more. I was losing more and more by the year. I was honestly worried whenever I turned 21 that I was going to wake up and the pillow was going to be full of hair. Thankfully that didn't happen, however there wasn't a lot left still.
Often, when you hear someone looking for hair transplant at the age of 24, you wonder, is he too young to have a hair transplant? Our approach is to be careful, not to rush into a decision. When I met Rhys, we had a video consultation first, then an in-person consult before we proceed to treatment. When I assessed Rhys, one of the key features I was looking for is a good donor area. I look at his photos in the pre-assessment, I look at his donor in the video consult, and when he comes in for an in-person consult, I examine his scalp for good donor area. And he has got a good donor area with good density. Although he's got fine hair, but he has got light scalp to hair contrast, which really helps in his case. One of the key points is that we are unable to treat front to back in a single treatment. What we did is a high-ish hairline design and trying to limit the treatment area to maintain a high density. Here are the technical details of his hair transplant treatment. Here is how Rhys looked after 2 years. Really natural, really elegant result. And he keeps his hair long, which does help the coverage in the area. Rhys' donor area shows minimal signs. All the effort that we put into his donor area is seeing the light of the day. This is donor area after 2,513 grafts, with plenty of resource to use in the future. For my younger patients who are in their 20s, they often receive the advice of, don't think about hair transplant when you're young, or you will regret it when you have a hair transplant when you're young. Or more common advice is to wait until you lose more hair before you have a hair transplant. In my hair transplant career, it breaks my heart when I see patients who has waited before the hair transplant. They follow the advice to wait, but without protecting their native hair. If they have been protecting their native hair with medications or non-surgical treatment, they will have preserved so much more of their native hair. What that means, they don't need to have such a big treatment in the transplanted area, and will help to preserve the donor. Donor is a limited resource. Imagine you use less of that resource and you have more to use in the future. I believe there's a better approach. Number one, proactively to stop and slow down future hair loss with anti-hair loss medication and non-surgical treatment. And number two, if you're still looking for further improvement, then you can consider hair transplant treatment. Now, that's very different from just waiting without doing anything. Frontal area hair restoration is always worthwhile when done correctly. It restores the frontal area and it frames the face better. With the appropriate hairline location and the treatment area, you would say the treatment will be almost the same for someone in their 25 or 55. Of course, when considering hair transplant treatment, there's the pros and cons and its limitation to consider. We shouldn't underestimate the impact of hair loss, especially for younger patients. Often, they just want to look their age, and we shouldn't take away their right to look good. Let's hear it from Rhys.
One thing I can say about having the hair transplant and how it made me feel was the confidence in yourself instantly boosted. One point I did mention was how every day it almost seemed like every time you walked by a mirror you looked at yourself. I would say I got the freedom back of every day. I am no longer worried every time I walk by a mirror anymore. I actually probably, despite what I have had it done, I probably care less about it because I've had it done, because it gave me a bit more of the freedom and to actually look at myself and see myself in the mirror again.
I'm Dr. Mark Tam. Thank you for watching.